Muy buenas noches. Muy bien, pues son las 19 horas.
All right, it's 7 p.m. of Sunday, April the 12th, 2020. We are at the National Palace and we are about to begin the daily press update regarding COVID-19, the disease caused by the new coronavirus SARS-CoV-2. We'll be presenting the daily technical report by Dr. Zalomia, who is the General Director of Epidemiology. We also have the General Director of the Center for the Promotion of Health, and he's been leading the teams that are creating the materials that are available in the website coronavirus.gov.mx. Yesterday we were presenting the informative materials for children, and they were presented by Dr. Alomia, and today we will be presenting some other materials that are for spreading information that are available in our websites. So we would like to present them to everyone so you know how to access them, how to use them, etc. So Dr. Alomia, please will you begin with the daily technical report? Thank you. Good evening, everyone. Let's begin by looking at the international landscape, what has happened during the past 24 hours and the past 14 days. The proportion of confirmed cases continues to decrease. Yesterday we had a 65%, now we're looking at a 63%, and the fatality rate hasn't increased nor decreased. It's still at an average of 6.2 globally. Next slide, we can take a look at the comparison between the European region and the Americas. We've been talking about how several European countries are now exhibiting a trend which is a downward trend. It seems that some of these countries have reached their peak when it comes to the rhythm of the spread of the disease, and now they're slowly coming down. And the Americas continues to go up. Next slide, we can take a look at the updated Mexican situation. To this day, we have over 4,000 confirmed cases, 4,661 cases to be specific. Also, out of all the patients that have been tested, we have a number of tests that are come out negative. So we have 8,697 negative cases. Unfortunately, we also have more deaths. The total death toll so far is 296. Next slide, we can take a look. We included this information again so you can have a look at the raw numbers of the number of cases per state. But the one that is more interesting and more important is the next slide, because these raw numbers need to be analyzed, taking into account the population within each state. And what we are referring to is the incidence rate, which is the number of confirmed cases per 100,000 inhabitants. We can see how there's variation among states that goes from 14.9 to 0.65. Here we have two important information sources. One of them on the right side, you can look at the proportion of infected patients as regarding their gender or their sex. So we have 58% of the patients are male, 42 are female. We also have on the left side the age group distribution of the cases so far. You can see how the yellow bar, especially for those older age groups, over 60-year-old citizens, they have a higher proportion of hospitalized cases as compared to those that are outpatients. So you can see how this talks about how the older a citizen is, the more likely they are to present complications and have to be hospitalized. We've been talking about age is an important risk factor, and that can lead to hospitalization and eventual emergency medical treatment. Here we have the proportion of of patients as per the current state. We have 66% of outpatients, 10% of hospitalized stable patients, and the other ones are for the severe condition patients and the intubated patients. Here we have the comorbidity relation for the confirmed fatalities so far. We can see the leading three conditions that are risk factors that can potentially lead to death are still hypertension, diabetes, obesity, and to a minor extent, smoking, kidney failure, cardiovascular disease, immunosuppression, asthma, and HIV. We've talked about how unfortunately we've had 2 pregnant women so far who have died from COVID, and they both presented these conditions: obesity, diabetes, and hypertension. Now we have the age group distribution for the death toll, and here we are dividing the population in groups under 25, 25 to 59, and over 60. We can see how the percentage is greater on the middle. For the amount of for the amount of positive, the percentage is greater on the age group 25 to 59, but the fatality rate is definitely bigger in those patients that are over 60. Now here we have the fatality rate per state that shows some variation depending on each state population and how many confirmed cases are there in each state. So we see we have a fatality rate of 25 to 1.67 depending on the state. Remember, the fatality rate is the number of confirmed cases, the number of deceased patients as compared to the number of infected patients. And the mortality rate, which is the one we're looking at right now, is the number of deaths in comparison to the population within each state. Now, we can take a look here at something we've been talking about, and we will continue to talk about more frequently during the upcoming weeks, which is the positivity percentage that COVID-19 currently has. In this graphic, we can see a contrast between the influenza positivity percentage and the COVID-19 positivity percentage. Remember, influenza is also an epidemic disease, and it also causes similar symptoms, and it can be fatal, just as COVID-19. So we are looking at how the data has changed. While influenza had a positivity rate that was higher in the beginning, in the early stages, now COVID-19 has a higher positivity percentage, and influenza has gone down. Now we can see how the highest point of positivity rate for the COVID-19 was on week 14. We reached 19.36, Now it has gone down to a 15.18, but this data will continue to change. But so far we can say that out of 10 people who present and some sort of respiratory infectious disease, 2 of them have COVID-19. Out of 10, 2. Now this relation can change also depending on each state. The relation can be bigger or lower in different states. There are some states in which we have a 30% relation, which is out of 10 patients that are diagnosed with a respiratory infectious disease, 3 of them end up being COVID-19 infected patients. But we will continue to see how this data changes as we move forward. Next slide, we can see the number of recovered patients so far. We have 1,843 cases, which represent 40% of the total confirmed cases of the disease. And we can look at this graph. We are presenting the information taking as a point of reference the date in which the symptoms started in these patients. So happily we have this amount of people who have recovered, and nowadays currently they are immune to the disease, and hopefully they can contribute to what eventually we expect to see, which would be the more generalized immunity within the population that can help us face this pandemic in the future. Here we have the epidemic curve of suspect cases. If you remember, we have 8,697 cases that are still suspect, which is we're waiting for the results of the tests. And this is the tendency that the number of suspect cases has been showing during the past few weeks. We are talking about the accumulated cases here, and they are ordered by the date in which the symptoms started. The National Epidemiological Vigilance System has a platform for the monitoring of viral respiratory diseases, and all of the people who participate in these systems can input their information and their data on the platform directly, and we have an update of the overall information every 24 hours. So every 24 hours we can access this online database and have the latest information regarding the trends of newly confirmed cases every day, and use this information to establish if the trend is slowing down or is sustaining or is becoming more steep. But of course this is important, because in this way we can measure and we can judge whether the massive mitigation measures that we've been implementing are being effective or not, and we will know this in a week or so. Last but not least, we have the epidemic curve of accumulated and incident cases. So we have the orange bars, which is the newly confirmed cases every day, and we have the curve that represents the overall advancement of the epidemic since it started in our country. Thank you very much, Dr. Alamia. Dr. Cortez Alcalá, now you have the floor. Can you share with us what you have prepared for this evening? Thank you, Deputy Secretary. Before starting my presentation and sharing with you this information that I have prepared, and that not only I, but my whole team, and with the support of many different teams dedicated to social communication, teams from the President's office, from the Secretary for the Promotion of Health, but I also want to thank those people that have been in communication with me through Twitter because their input is important. The result of communicating with the overall population through social media led us to have a section that we think is better than before. That of course is always can always be perfected, but this is specifically for addressing those people that have some sort of disability. Right? So this is the front page of our website. This is the first thing citizens see. Stay at home, the hashtag, and then you see the links to download the app in any of your devices. This app has been rather successful. We have over 100,000 downloads so far, and as the more people start using this app, the more information we have available to build a ever more robust database that allows us to have a better decision making process. Now, these are some of the functions of the app that I think are very interesting. We have accessible information, we have COVID-19 related courses, a directory of contacts per state, some recommendations for taking care of your mental health. We have a children's section. We have general recommendations for the population, frequently asked questions, interesting sites, recommendations for health professionals, myths and realities, which are very important because it is important that the population and the citizens get in touch with us through social media and let us know which other myths or stories they've heard about this, and we can help them establish whether this is a myth or is a reality. We also have a section for consultation materials, in which this is basically a section where you can refer to if you want to take a look at all the different protocols and guidelines that we have been designing for the management of this crisis, and specifically those aimed at people with some sort of disability. We also have a gender perspective section that has specific materials regarding this topic, and we have 3 buttons that are very specific and very special. One of them is With You in the Distance, which is a program of access to culture that we can basically, this is an initiative by the Ministry of Culture, and through this button we can have virtual access to all of our museums nationwide without leaving home. We also have this other button which is Together at Work, which has plenty of recommendations for work-related topics, and it has a variety of resources in indigenous people's languages in order to make more accessible the information for the totality of the population. Here, these are the health emergency measures that you can also access through this website. Some basic points like the everyday prevention measures, some information regarding when should you seek medical attention. Through this page you can better understand who is a suspect case of COVID. Well, those people who have a cough, a fever, or headache. At least 2 out of these 3, and at least 1 of these 5. Breathing impairment, throat ache, nasal secretions, red eyes, muscular pain. These are all symptoms that can be manifested, and if you meet some of them, that you should seek for medical attention. This is also we have the contact information for the blood donor national system. All of the numbers are here. If you want to donate blood, please do not hesitate to call up any of these numbers because we need your donation. Here we have another section for the daily report, the press conferences, and other interesting stuff. Now here we have different submenus that they have a different organization. We have made some changes in reorganizing the interface so it's more user friendly. So can we click on the accessible information one? Yes, this icon tells us that we have installed a plugin for people with visual disability to be able to listen to this material. This material was designed with the collaboration of CONAPRED through the president of CONAPRED, the President Bonica Mastiza. And we believe now that through these changes that we've been implementing, we believe that now this information is more accessible. Now, we would like to ask our citizens and our communicators and our activists to help us spread this information and keep criticizing our work, because critiquing is not only valid but is also useful for us. There are many things that we do not necessarily realize, and you have the possibility from your home to take a look at our resources, and you can send us your feedback and your recommendations. And if we need to improve some of this information and some of these resources, we will do it for the betterment of our overall population. So here we have some other sections. We've been talking about myths and realities, training for people, and public interest documents. Let's see, for example, prevention measures. And it says here, well, you are playing an important role in stopping COVID-19. So it says, wash your hands with water and soap, go to your doctor only in emergency situations, cover yourself when you cough or sneeze, and do not spread fake news. That one's really important. Let's go to another section, for example. Senior citizens. This is senior citizen specific information. And you can read it, but there is also a way of listening to this information if you prefer to listen to it. But all of this information has been collected with the support of the National Institution for Senior Citizens and some other institutions. It's been a joint work in designing and creating these resources. At the end, we also present what are the important symptoms and the alarm signs. And at the end, you have a link to the National Institute for Senior Citizens. And there you can have even more in-depth and more detailed information and resources regarding special measures that senior citizens can adopt to protect themselves amidst this crisis. Let's take a look at the myths and realities section. And we have a number of icons that when you touch it, they show you the other side. So one side is the myth, and then the back side is realities. If you click on one, then it shows you the reality, right? So for example, myth is you can test coronavirus with a fast test, and the reality is no, you need to do a CPR test. Myth, the N95 face masks are reusable. Reality, no, they're not, and so on and so forth. You can take a look at all the different myths and realities that we have detected and that we have refuted using scientific literature and and resources. Now, can we click on the training section? We have a variety of courses that, together with IMSS and with other institutions, we have created these courses that are addressed at all of the population. So all of us from our homes can have a better grasp at COVID-19, what should we do, what should we not do, etc. We also have an important section which is Contacto. If you click on the button that says Call Now, automatically your computer or your phone, if you're looking at your phone, it will call the number, the 800-00-44800. And we also have a directory for direct lines depending on your specific location. So for example, if you live in Baja California, you can specifically call these 4 numbers to get attention within Baja California. If you live in Coahuila, then you should dial 911. Also Campeche, you should dial 911. Each state has specific numbers that they have designated for providing direct attention. Last but not least, this is the personal information section, which takes us to the National Institute for the Public Access to Information. We are working very hard in collaboration with the Institute to protect everyone's personal information and to protect your privacy. Can we go back one slide to the COVID main page? Oh. We also have a section which is specifically directed to the medical practitioners and to the health personnel in our country. Remember that if overall citizens are feeling tired of having to work every day, we don't even want to imagine those heroes that are working at the hospital. They deserve all of our admiration, all of our estimation, all of our empathy, and all of our understanding, because those professionals are suffering along with the patients they are treating. And we have created these resources to help them too and to orient the population in general. For example, we have here how this is specifically guidelines for managing patients. How to deal with a patient who is feeling very anxious, who is feeling very angry, or who is feeling very afraid, and so on and so forth. I think these are some important relevant information regarding the page. The page is very complete. It has a lot of resources. I just wanted to show a few so you get an idea to all of the things you can see and do in this page. We have over 10 million users that have had access to this web page so far, and this is thanks to these daily conferences, and this is thanks to you journalists who are here no matter whether it rains or whether it's a Sunday or it's a Saturday. You're always here every day, and thanks to you we have reached 10 million people, and with your help we will reach millions more. Thank you very much, Dr. Alcalá. Before we move to the Q&A section, it's really important for us to present this information to you. As you heard, we've had 10 million people that have had access to this website. So that's the number of people, but the average interaction number is two per person. So we have over 20 million interactions with the site so far. This is very important because this is an overall governmental effort. The design and the implementation of these measures is responsibility, according to our constitution, it is responsibility of the health authority, being that the Ministry of Health. So I am very happy to celebrate that Dr. Alcocer, who is a leader in the of the who is the Secretary of Health. He has maintained a great spirit of joint work, of collaboration, and this collaboration and this solidarity, we can see it manifested through these great products that come up as a result of this great work by all the different institutions within the federal government. For example, the Ministry of Culture has done a very, very important work in this regard, and it has been working closely with the Ministry of Health. So thank you for that. But something that is very important, is extremely important in order to get an effective answer, is this sense of unity, collaboration, integration, a generous attitude in which we leave our egos behind, and each of us, we have to contribute to what we can contribute, so we can all together as a people pull through this pandemic. And I would like to make a call to all of the sectors of society, public sector, private sector, social sector, to each of you to contribute in the way most of citizens are already contributing nowadays. This is a positive effort. The different contributions have to do with doing your fair share, but also going a little bit beyond that and go the extra mile when contributing for the better and the higher cause, which is our people. And thank you, communicators, journalists who have been here every day. This is the 44th information session. We only skipped one day, which was March the 8th, because there were some other activities programmed. But we have had daily conferences for 44 days now. We have a lot to come. We are not going to be stopping anytime soon. There's a lot of questions to be answered. There's a lot of information to be presented. So we will continue, but I would like to thank you, communicators, for being here every day and joining us in this effort. Thank you. Let's begin with the Q&A period. Thank you, Doctor. Tomorrow, President López Obrador is going to be presenting a general balance of the COVID-19 situation. Do you think it is possible that tomorrow phase 3 will be officially stated? No. The movement between one stage or one phase to the other is not a linear process. It's that we cannot make estimations based on the past. So we have been preparing for this for weeks. We have three. From the very beginning of the pandemic, we established the different elements corresponding to the first three phases, which is imported cases, phase 1, community transmission, phase 2, and then phase 3, which would be the one that we will move forward to eventually. But the most important thing is, what are the activities that need to be implemented during each phase? In phase 1, the most important aspect was the contention of each case, the identification, the studies, and the tracking of the infected person's movements and contact network. Now, when we moved to phase 2, these measures became ineffective because the more cases we have, we just don't have enough resources. Nobody has enough resources to keep this system of closely tracking each of them. So when we saw it fit, in order to be ahead of COVID, we officially declared phase 2 on March the 30th in order to be early and to be more effective in our contention of the virus. So phase 2 is characterized, and right now this is the most important thing, stay at home, stay at home. That is what these measures, these massive measures represent. And they include the temporal suspension of activities in schools, in non-essential sectors of the economy, and of course the avoidance of public gatherings over 50 people. Now, phase 3, that we will unfortunately reach, as we have said it day after day, and we will be getting there pretty soon, has two main characteristics. One, because of the dispersed propagation of the virus, which means there are several outbreaks within the community that start to conglomerate. This means that, for example, in one region you have an outbreak here, an outbreak there, and then these two outbreaks intersect together, for example. And then you can't tell one outbreak from the other one, because there are people who are moving from one place to the other during the day, and they are linked by transmission chains. So the number of cases has an illustrative function. We've said phase 1, we're talking about tens. Phase 2, you have hundreds. Phase 3, you have thousands. But the defining aspect of phase 3 is not the number of cases. The defining aspect is the overworking of public hospitals and just the health service infrastructure overall. So the most decisive and the most important thing for phase 3 is to guarantee that we have enough capabilities in the health sector to provide treatment to all of the people who need it. We've said once and again that the health sector in Mexico has great challenges and great difficulties that have been accumulating over more than 4 decades, and we have been working non-stop in order to increase these capacities of the health sector to be prepared for phase 3. But let's not forget the most important thing about these measures is to avoid the biggest number of contagions. So keep this in mind. It's not that when we get to phase 3, then we need to extreme precaution to reduce the number of increased infected cases, because when phase 3 is here, it would be too late. Whatever efforts we've done and have been effective will have been done during phase 2, not during phase 3. So stay at home, please stay at home. Thank you. President Andrés Manuel requested the government of the United States the selling of a certain number of ventilators. Can you talk about the quote and how many ventilators are we talking about? Also, I would like to know, are we buying ventilators from China currently? And also, I would like to ask you, within the request that the president did to political parties of donating part of their budget, only a few political parties agreed. So, can you talk about this? Also, the resources that are needed to deal with the pandemic, how much are we talking about? And also, how many studied cases we have so far, because I didn't quite catch that. Also, thank you. Yes, that would be all. What we asked to the President of the United States was 10,000 ventilators and 10,000 monitors. We have identified from the beginning what we call the COVID package, which is the altogether supplies and human resources that are needed to provide treatment to a hospitalized patient and to a hospitalized patient in critical condition. To the critical condition ones, this COVID pack includes a ventilator and a monitor, among other equipment and other supplies. So the president of Mexico, Andrés Manuel López Obrador, he had several conversations with President Trump of the United States, and he expressed the petition of support to facilitate access to certain products in the US market, specifically ventilators and monitors. The response was positive. We still don't have a concrete agreement. It requires some time for them to analyze the different mechanisms in order to make this happen. As you know, the United States is also dealing with their own epidemic and with their own challenges, but we will likely have a response, a final response next week. Also, talking about China, and thank you to the Secretary of Foreign Affairs and to his great team for their collaboration and their work in buying and searching these supplies and this equipment that had been scarce overall in the global markets. So they've done a great work. And talking about this fake news and distorted information, some people are saying that Mexico sold their masks to China and now we can buy them. We have to buy them back 30 times the price. This is definitely a distortion. I don't know if it's an accident or if it's an intentional distortion. I believe is in part the result of an interview that I gave a week ago, and this of course comes from the ignorance of certain people or the denial to see reality. What the journalist that interviewed me was talking about at the moment was that Mexico and China are the major producers of some health-related supplies, specifically these personal protection equipments that include masks, the N95, goggles, etc. And this is not because Mexico has a national company that manufactures this, but because Mexico is a very reliable country in economic terms, and it has multiple manufacturing sites and companies, and some of them are great manufacturers for the world. So in February, when China had an increased demand of these kind of supplies, because it was the epicenter of the pandemic, China requested the global markets these supplies, and one of the suppliers was factories that were in Mexico. So there was, I mean, these are private companies. There was no reason to prevent them from selling their products. It just doesn't make sense. And now we need them because the situation is different. So in February, China bought it in Mexico, and now Mexico buys it in China. So that's how commerce works. Now, talking about the operative commands. Oh, the political parties. I don't really know about political parties. That you can ask that the president. That's a political matter that it doesn't involve me or concern me. Every time the INSABI colleagues come, we've talked about the needs of resources, human resources, the budget we have, the budget we need. We've been presenting this information, but what is great news is the enormous support and the decision made by the president to not withhold any resources to deal with this pandemic. And what you're talking about, the operative commands, each institution has its own operative command. ISTE has its own, IMSS has its own, the Ministry of Health has its own. These are mechanisms to respond to emergency situations such as these ones. So, and you put together those three institutions, we have a macro operative command, and we also, in collaboration with the civil protection national system, we have an even bigger operative command that also involves the help of the Army and of the Navy. So we are all coordinated. Yes, and talking about the negative network system, which has been operating since last week, that this new system is aimed at monitoring the condition of the patients that have been hospitalized because of acute respiratory infectious disease. It doesn't mean that all of these people have COVID-19. Actually, if you see at the positivity rate, we were talking about 20% of the respiratory infections are because of COVID, and this percentage will show some variation in the future as we move into phase 3. But out of this negative monitoring network, today we have the updated report of 450 people who are intubated because of respiratory infection. Yeah? So the report we get through another system of monitoring that is specifically aimed at COVID-19, it talks about 185 intubated patients specifically because of COVID-19. Thank you. I would like to ask you, there is great concern among people who are going home with mild symptoms, and they ask them to stay isolated 14 days. How can they be sure that after these 14 days they can stop being isolated and they are not a hazard to others? Also, there are people who are isolating at home and they are presenting complications while at home. What has happened? What has to happen there? Do the relatives have to take them to the hospital, or do we have ambulances that can go pick them up? Also, we've been hearing of data presented by IMSS, by the Ministry of Health, but I haven't heard any information regarding ISTE. And there are thousands of employers that are affiliated to ISTE, so we would like to know some information regarding that. The information that we've been presenting overall includes ISTE, and it includes all of the medical units and medical institutions and health authorities in Mexico. It includes the 32 state health systems. It includes some units that are coordinated by INSABI. So the information is general information. It's the same information for all of the institutions, roughly. Each of them is doing their own work, but it's all taken into account. The technical documents are also sector-based, but all of this has been presented, taking into account all of these institutions. Now, what you're asking about what has a person who exhibits symptoms, what should they do? This question was asked yesterday, but it's always good to talk about it again. There are two things that we have to identify. There are two groups. One group is the people who have low risk of presenting complications, and these people are under 60 years old, they do not have any chronic conditions, and they are not pregnant women. These people, because they have such a low risk of complication, it's better for them to stay at home, isolate themselves. If they have these symptoms that are characteristic of COVID, that have just been mentioned by the doctor, which are at least 2 out of 3, which is coughing, headache, or throat, and some accessory symptoms such as muscle pain or a fever. But if you have these symptoms and you're not at risk, or you're not at a elevated risk population, you should stay at home. But if you belong to a vulnerable group, meaning you're over 60 years old, or you present any pre-existing chronic conditions such as diabetes, obesity, hypertension, smoking, kidney failure, cardiovascular disease, or if you're a pregnant woman, then you are at risk and you should seek for the corresponding medical attention. Of course, we will provide the medical treatment to whoever needs it. We just put the... Remember the number, 800-0044-800, 800-0044-800, 800-0044-800. That is the line. you can call if you need medical assistance. If you are at an emergency, 911. 911, that is the universal emergency number. And since 2 months ago, we have integrated the communication systems so that by calling 911, you can also have access to COVID-19 specialized orientation. Yes, it's been, we had a saturation phenomena 6 weeks ago after some fake news were spreaded, but we had to remodel the assistance center, and now we have a very, very capable and very extended telephonic assistance center. And also, let me say that the ISTE phone assistance center is also providing support through these numbers, because they had a call center that had 400 workers nationwide, and they are also working together with us in this. And yes, the disease on average lasts 6 to 10 days. Incubation period 7 days, and it lasts 5 to 6 to 10 days. The infectious period is the most important infectious period is day 6 to day 8, and it is rare for people to still be able to spread the disease at day 12 or 13, but as a precaution, we recommend to make it in isolation until day 14th. After day 14th of isolation, the person can go out and they can safely interact with other people. Yes. I have two questions. First one is to Dr. Alomia. So we have a universe of 1,800 recovered patients, which is really good. So out of these recovered patients, how many have been extubated? Have any sequels been detected with these recovered patients? And how many people of these recovered patients are participating in the protocol plasma treatment research trials? Also, Deputy Secretary, there are some people who are currently working, delivering food, working at markets, driving taxis. What are some recommendations for them that cannot stop working? How can they better protect themselves and others? Yes. Okay, I'll take your question about the recovered patients. We have the information in order to calculate the data you want, and we can do those calculations, and I will present the answer to you tomorrow. And yes, thank you for that question, because all of the questions are very valuable, but questions as this one really talk about there are some people that might have this concern, and we want to talk to those people through you. These people who have continued to work, cashiers, delivery, men and women, drivers, all of the workers that are currently still working, it is more than understandable that they are concerned for their safety. How can they protect themselves while being out there? An additional question could be, if I get COVID-19 and go back to my home and spread COVID to my family, what then? This is also an important question. So the measures, the precautions are general, like washing your hands. That is extremely important. It's not once, twice, or 5. It's 15, 20, 30 times a day. And also for a long enough period of time so it can be an effective. This is 20 to 30 seconds. Yeah? Maybe you can sing a song, yeah, to make it easier, the wait. But washing your hands is fundamental. The other important element is safe distance. If we all keep our safe distance, this will help reduce the probability of receiving the saliva drops of the little particles of respiratory secretion of someone who could be infected. As an extra measure of precaution, if someone is presenting symptoms, then you shouldn't go out. If you're showing symptoms, then you shouldn't go out. You should isolate yourself. If you are not at an elevated risk population, then stay at home, isolate yourself for 14 days. Cover you when you sneeze, or when you cough. But it's also very important that there is no one going out to work if they belong to a vulnerable group. If they are over 60 or have any pre-existing chronic conditions, or if they are pregnant women, they shouldn't be going to work. Now, the risk of being exposed for these people has decreased substantially because we have decreased the social mobility rates all over the city and in different cities. But let's be aware that this virus could get to any of us, so we have to be precautious. Now, talking about the mask, for example, the mask topic, this has been a controversial topic, but I will remind you again. The Centers for the Control of Disease in the United States recommended the generalized use of face masks as an additional precaution measure. Like 48 hours after that, World Health Organization made an official statement that said there is no scientific evidence that conclusively demonstrates that this is an effective generalized measure against the pandemic. Could it be of some help? Sure. But remember, if you already have COVID, you wear a mask, you are reducing the probability of spreading the disease. But please understand that this is not a protection measure for someone who is not infected and he wants to protect himself or herself from being infected, because the virus enters through the eyes as well. And also think about having the face mask on you all day will lead to being hot, to sweating, and then to be constantly touching your face unconsciously. And this is what we call risk compensation, because I'm wearing the face mask to reduce the risk, but because I am touching my face constantly, then I'm increasing the risk. Also, some people, if they're wearing the face mask, they feel safer, and then they stop washing their hands. They don't keep their safe distance, so it's not very effective in that way. Also, wearing gloves is senseless. It has no use when we're talking protection whatsoever, because the virus does not enter through the hands. The virus enters through your nose, your mouth, and your eyes. So if you're wearing gloves, yeah, the glove is clean for the first few seconds, maybe a couple of minutes, but after a while, it's just like if it was your hand. So if someone shakes your hand and you're wearing a glove and she had the virus, then the virus is on the glove, and then if you touch your face with the glove, then you're gonna get infected. So wearing gloves for the control of this pandemic is only gives us a fake sense of protection, but it's completely useless. Thank you. We will continue tomorrow.